What keeps Dr. Anthony Fauci up at night? The fact that some states still haven't gotten COVID under control just weeks before the weather gets cold. Here he is on CNN today.
What worries me the most, is that in those areas of the country, which is a large country, heterogeneous in many ways, if you don't have the control now, as we get towards the end of September, of getting such a low percentage that it is entirely manageable, when things change that work against you, and what works against you now is the fact that we're getting into a weather season where people will be spending more time indoors.
Dr. Uche Blackstock joins us now. She's an emergency medicine physician and the CEO of Advancing Health Equity. Dr. Blackstock, thank you so much for being with us. Dr. Fauci was worried there about what happens when people can no longer be spending as much time outdoors. How critical are the next several weeks in determining what kind of fall and winter outbreaks we are dealing with here in the U.S.?
So the next few weeks are incredibly critical. I can't, underestimate that enough and underemphasize that to people. What we do know is that moving indoors is essentially dangerous with coronavirus, and we're going to see that over the next few weeks. We also need to make sure that people are going to be wearing their masks and still physically distancing. So, in places where the transmission rate is still quite high, we're going to need people to be on extra guard and to enforce those preventive measures.
The UN's Deputy Secretary General told NBC News that COVID-19 could set back women's rights by decades because we are bearing so much of the burden during this pandemic. What are your specific concerns about the impact of COVID-19 on women, and what can we do to possibly correct or improve this situation?
So that's such a great question. What we've seen, we've seen the health consequences of it. I think, more invisible are the consequences relating to gender inequity and inequality. And we're seeing increased rates of domestic abuse. We're also seeing women at home more likely be taking on a higher share of childbearing and household responsibilities. They have been disproportionately impacted in terms of job loss, as well as being able to find new jobs. And so, we think about this pandemic in terms of health consequences, but really it's not. It's more expansive than that. And this is another reason for us trying to get this virus under control.
Dr. Blackstock, I'm sorry that we didn't have more time to talk to you today, but thank you so much for being with us, and I hope you'll come back.
Thanks for having me.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.